Hey everyone, welcome back to the channel. My name is Aryan Malik. I am currently a nursing student. This is Study With Me series. Today is day 16. We'll be starting with fundamentals, and the topic we'll be talking about today is the nursing process. So let's get into it. So nursing process, as I understand, is basically a combination of steps or system we follow to care for the clients, and it serves as a guide for us, and it's basically a systematic approach that is used to guide the client care. There are basically five steps which are incorporated into the nursing process, which are denoted by ADPIE. Let's break them down one by one. So A in ADPIE stands for assessment. It's basically gathering information and reviewing client history. It comes before any assessment, and we should always remember that it should always come first. Assessment is the first step, and we always start with gathering information. There are basically two types of data points that we talk about: objective and subjective. Objective is denoted by observed, anything that we observe on the client, for example, or anything that we can observe: physical exams, vital signs and symptoms, labs. Anything that is observed is objective sign. Then subjective, anything that the client says. So subjective says what the client says for the report, for example, stomach ache, chest pain, headache, nausea. Now let's go to the D in ADPIE, which stands for nursing diagnosis. It is basically identifying problems and replacing them in terms of priority. So the nursing diagnosis helps us shape clinical judgment about clients' physical status, psychological status, and much more. It also includes social factors, family, and community experience. Physical needs come before psychological needs. Example, we are always going to prioritize an airway issue before we treat an emotional issue. We should always, as a registered nurse, ask ourselves what is going to kill our client first. Say we have a client with pneumonia who has an oxygen saturation of 89%. What would be the most appropriate nursing diagnosis? It will be impaired gas exchange. Why? Because when we identify the keywords in the question, which is pneumonia and oxygen saturation 89%, it tells us that this is something which is directly related to the lungs. And and when we further break it down, we realize that the client is unable to get as much air, as much CO2 out, and the gas is not properly exchanging. Hence, this is a case of impaired gas exchange. Now, say a client with Crohn's disease feels overwhelmed and has not had any outside support since her recent divorce. Which nursing diagnoses are best for the plan of care? Select all that apply. So we'll be seeing here hopelessness, risk of deficient fluid volume, ineffective coping, and imbalanced nutrition. Stressors from both emotional and physical issue can lead to more problems, because if we go back to our options here, hopelessness and ineffective coping is a result of her feeling of depression or anxiety which came after the recent divorce. And when we look at risk of deficient fluid volume and imbalanced nutrition, that is a result of Crohn's disease, because the client is having many bowel movements. Now let's look at P in ADPIE, which is planning of care. It mainly entails goals, outcomes, and action plan. Here we discuss the plan with the client. Remember, it is very important to discuss the plan of care with the client so that the perceived needs of the client are met, but we need to make sure the needs are actual needs and they are not, they should be realistic desires. What would be the most appropriate way to assess if the plan of care correlates with the client's perceived needs? One should discuss the plan of care with the client. If the client comes in with dizziness and can't stand or walk, we first want to stabilize the client, and long-term goal is for them to stand and walk without feeling dizzy or falling over. And the goals can be characterized by an acronym that we use called SMART, wherein S stands for specific goals, which is, for example, the client should stand without dizziness. M is for measurable goals, like client will walk to 20 feet without dizziness. And A is attainable goals. The client will walk 20 feet, not 20 miles. It's something which is attainable. Then R stands for realistic goals. The client will walk, not do backflips. We should be very realistic in our goals. And T is timely goals, which is client will walk 20 feet without getting dizzy by day 3. Having the SMART acronym in mind helps us kind of picture our plan of care and put the goals in a way that aligns best with the interest of our client. Now let's look at an example of a poorly written outcome. Client will walk without dizziness. Now why is this outcome wrong? Because it doesn't talk about any objective, it is not specific or measurable, and there is no clear timeline here. Now let's compare it with another example of a SMART outcome. Client will demonstrate improved activity tolerance as evidenced by walking 20 feet without dizziness by day 3 of hospitalization. Now let's look at I in the acronym ADPIE. I stands for implementation. Here it's all about nursing actions and interventions, which include assess, monitor, observe, provide. Remember these keywords: assess, monitor, observe, provide, and anything related to procedures, meds, client education. Let's look at a question. Client with end-stage chronic kidney disease, what would be the interventions to include in the plan of care? Select all that apply. Assess for jugular vein distension. Provide frequent mouth rinses. Observe for Kussmaul respirations. Monitor for melena. Now, why is it important? Because here, even if you don't know the name of the words that are there, like jugular vein distension, we know the keywords that are in the option: assess, provide, observe, monitor. Now let's look at the last in a word letter in the ADPIE, E, which is for evaluation. It is objective and measurable. We are trying to see if the client is getting better or worse. We reassess the client and we ask ourselves, were the desired outcomes achieved? We adapt the plan of care based on our reassessment, and we identify potential errors or problems in the plan of care, and we make adjustments as needed. Now let's talk about a very important concept when it comes to discharge teaching, which is client education low literacy. Evaluating client's level of understanding. The teaching can be hindered by age, whether the client is young or old, by language barriers. Maybe they do not speak English and we might not able to have a translator in their language, their educational background, their anxiety, visual or hearing deficit, and their cultural background. These can be the factors which might hinder the patient education. And when we are giving discharge teaching or any education to the patient, we must assess their cognitive abilities, which is how's their thought process and intellect. For example, a client learning how to choose low sodium food choices. Now, another thing we need to assess is psychomotor abilities or skills, which involves physicality or action. For example, a client practicing medication administration, for example, insulin injection, we need to know if the client is able to do this efficiently on their own. Also, one more thing that we need to assess is for affective, which is involves emotions or feelings and basically checks for the readiness of the client. So a client's willingness to learn about the disease process. And one should always take the time to assess the client, because we need to make sure that we are sending them home well prepared and well equipped with all the resources they need that will help them get better. Now let's talk about instructional methods on how we as registered nurse can um, try our best to make sure that they are well equipped with all the knowledge that will help them recover. Written materials in primary language and using simple terms and appropriate reading level. So one needs to make sure that these are taken care of when we are dealing with someone who might have low literacy or the other factors we described. Demonstration, it is really important that we show the client on how a particular machine, say like incentive spirometer, works, so that they can kind of know firsthand on how to operate on it. And others include videos, audio recordings, books, and verified websites like Mayo Clinic, and not Wikipedia, which is not a scholarly website, or which is not something which has correct information. Now let's look at a question. Choose the best discharge teaching strategies for an 82-year-old client with a low literacy level who has been newly diagnosed with COPD. Now, even if we do not know what COPD means, let's first underline the keywords 82-year-old client, which means they're old, and low literacy level, which we just talked about. So the following interventions we as registered nurse will be taking will be printing out pictures showing the steps of correct inhaler use, will be performing discharge teaching with a family member present, and will be showing the client a professionally produced video from a credible source. Now, last we talk about evaluation methods. Teach back. The client will demonstrate their learning by explaining it back to the nurse. So whenever you are finished teaching a client, always encourage them to teach you back, so that you can assess their abilities to perform in your absence, and you can rectify or correct any small mistakes they might be making. I hope you found this video helpful. Please stay tuned for more videos that come in the future. Thank you for tuning in.